If your doctor just prescribed you Mounjaro, you might have some questions about what it does and how the injectable treatment works. Mounjaro is a new, non-insulin injectable type of medication for the treatment of type 2 diabetes. While other injectable diabetes medications activate only the GLP-1 pathway, Mounjaro also activates the GIP pathway. Both of these pathways help your body release its own insulin. They also reduce food cravings by sending signals to your brain to indicate that you are full. Because of this, patients taking Mounjaro can sometimes lose weight. And because of how it works, some people experience side effects like nausea. So your doctor may start you with a lower dosage and increase it gradually. Along with a healthy diet and exercise, Mounjaro can be a very effective medication to patients with diabetes, especially those struggling with weight. Let's go through how to do the injection. Mounjaro is a once-weekly medication. The box of pen should be stored in the refrigerator but never frozen. If refrigeration is not possible for any reason, the pen can be kept at room temperature for up to 21 days. On the day of your injection, take the pen out of the refrigerator 30 minutes ahead of time. With Mounjaro's pen, you never have to see the needle. When you are ready, simply remove the gray cap and place the pen on the skin of your belly or thigh, avoiding any scars, rashes, or your belly button. It is recommended you choose a different injection site each time you inject. Twist the top of the pen to unlock it and press the purple button until you hear a click. Keep holding the purple button until you hear the second click, and after hearing the second click, you can remove the pen. You should be able to see a gray plunger indicating the injection is complete. Be sure to dispose of the used pen in a sharps container, not directly in your trash or recycling. That's it. If you miss a dose, take it as soon as you remember. But if it's been more than 3 days or 72 hours, wait until your next scheduled dose. If you have any additional questions about how to use your injection pen, ask your doctor before you take the next dose.